I think, in the clinical space you have a lot of LC-MS assays in therapeutic drug monitoring, vitamin testing or other clinical applications. And the problem, there are a couple of problems connected to this. One is the sample throughput. So it takes minutes to run a single patient sample at this point. And it is also a method which is not robust in everybody's hands. So it needs experts. And it has a significant downtime. It needs really curation, actually. So what we want to try to do is to eliminate the major part of trouble, which is the chromatography part. And we intend to run these clinical assays with our new DART technology. DART stands for Direct Analysis in Real Time. So we eliminate chromatography and run the same samples with a triple quad coupled to a DART source. What we've recently done is we have acquired a majority of a company called Recipe. And Recipe is a major provider of IVDR certified in vitro diagnostic kits, like for therapeutic drug monitoring, vitamins and others, based on LC-MS. And we have run a couple of studies with them with their assays using DART instead, so eliminating chromatography. And the data really shows that this chrome-free technology could be potentially a new tool in clinical applications for these kind of therapeutic drug monitoring quantitation. Currently these are research use only assays, right? So it's not connected to any clinical applications, but we're working on IVDR certification for those now and hope that we can move them into the market relatively soon. And the advantage is really a much higher sample throughput. So we are about 10 times, at least 10 times faster than any conventional LC-MS method in the field. And the connecting advantages are, of course, lower costs, more samples per time, ease of use because you don't need to take care of the chromatography anymore, and also higher uptime and robustness of the system.